A good and godly day ahead for all of you out there watching Agenda. Welcome to the program. I'm your host, Cito Beltran, and you are watching us via Signal TV channels 8 and 250, as well as on facebook.com/OneNewsPH and YouTube. Just type in One News PH. Welcome to the program and welcome to a new week. It's January 25, 2021. It's Monday, and we have a lineup of guests that will be interesting, and I'm sure will provide some important information as we go through the week. We will be speaking with Mr. Prospero de Vera, or Chairman Prospero de Vera III of the Commission on Higher Education, or CHED, regarding all of this brouhaha, hindi pagkakasunduan or nagkakagirian dito sa mga bitaw ng Department of National Defense, as well as on the part of the state universities and colleges. Okay, kasi hindi na po UP lang, nadamay na rin po yung ibang state universities and colleges. So we'll ask the CHED what their role is in all of this, what can they do, and what is their definition of academic freedom. After that, we will go to Undersecretary Maria Rosario Vergeire of the Department of Health, because I think it is important that we all get an idea of what's going on. Over the weekend, Prime Minister Boris Johnson of the United Kingdom came out with a statement, or at least I saw it during the weekend, where he categorically said the UK variant of COVID-19, the one we refer to as B117, is confirmed to be really highly transmissible, highly contagious, more contagious than the original COVID-19 virus. But the kicker was that it was also more dangerous or deadly, because according to their statistics, at least that's how I interpreted what he was saying. Alam nyo, hindi naman tayo Inglesero. He was saying that their numbers are up as far as hospital confinements are concerned, and the kind of confinements that were happening. So they were very alarmed with this B117. Okay, so we will speak with Yusek Vergeire, and last but not the least, someone I enjoy speaking to as well, like our other guest for today, will be Dr. Rontgene Solante of the Adult Infectious Disease Department. He heads that department at the San Lazaro Hospital, kasi kailangan malaman natin, ito bang B117, does it require a different protocol of treatment or at least management? Kasi wala naman po talagang gamot sa COVID-19. Yung vaccine nga, hinihintay pa natin. But how serious is it? Anong nakikita nila in terms of hospital numbers? Are we going to have problems? As well as, are they concerned with the announcement that yung mga minor de edad, yung mga bata, yung mga 10 years old, etc., papayagan ng makalabas, ano ang basa nila dito? So, let's go on with the program. It's 8:03 already. Let's take a look at the front page of the Philippine Star. Okay. Defense Secretary Delfin Lorenzana is now asking the University of the Philippines to help the government put an end to the insurgency problem. This after abrogating the 1989 UP-DND Accord. Meanwhile, 4 of the country's most prestigious universities have issued a joint statement to deny the claim that they are communist recruitment havens. Okay. Next up, let's go to the news on COVID-19. As health authorities are still searching for the carrier of the UK variant in BONTOC, 12 BONTOC province. I mean, BONTOC town. Anyway, 12 cases of the new variant were found in the town, BONTOC town. Okay, we will speak later on the show with Health Undersecretary Maria Rosario Vergeire to discuss this matter. The BONTOC Mountain Province. Ayun. Thank you, Gabriel. Okay. The Interagency Task Force or IATF makes it clear that minors in modified GCQ areas can only go outdoors if they are with their parents. Last week, the IATF lowered the age restriction protocol, now allowing those 10 years old and above to leave their homes. Ang tanong po, and I do hope that the IATF or someone from the IATF could consider the point naman ng mga senior citizens, 65 and above, or 65 to 70 man lang, because many of them are saying, yes, we are senior citizens, but most of us in the 65 to 70 category are well able to take care of ourselves, look after ourselves, and observe the health protocols. Okay, after getting approval last week, the Philippine Red Cross is set to roll out saliva testing for COVID-19 today. And last but not the least, the government is set to enforce measures to combat the high prices of basic commodities like food. Okay, alam niyo po, over the weekend, nabasa ko na ang balak ng Department of Agriculture or ang pang kanilang appeal ay mapababa yung presyo ng baboy from 400 to 450 to down to 250 or 275. Paalala lang po natin kasi alam naman nyo na ako ay for the last 5 years, I'm a volunteer lecturer of BMEG Feeds, the number one feed company, animal feed company in the country, and I travel all over the country. The reality is the price of raising hogs, especially during COVID-19, has practically doubled. Kasi noon po, kung magbebenta ka ng baboy, ilalagay mo lang sa truck, dadalhin mo doon sa katayan at ibebenta mo na o sa palengke, bahala na sila sa buhay nila. But now, you actually have to go to a designated laboratory and pay something like 30,000 pesos yata yan for so many hogs. Yung isang truck ba ng baboy, umabot yata ng 30,000 yung test. Kung mga 3, 4, 3,000 something. So may karagdagang gasto sa pagbababoy ngayon in terms of permit laang. Hindi pa po kasali. It does not include the added cost of disinfection, of biosecurity, of giving more nutrition to the pigs, etc., and handling. So medyo, alam niyo po, ito ang worry ko. Baka pag pinwersa ng gobyernong ibaba yung presyo sa hindi reasonable, ang mangyari, talagang matuluyan na yung hog industry kasi the only reason the other hog raisers are staying in the game, I've left the game, okay, I will just be a lecturer and asikasuhin ko na lang yung aking manukan, sinasabi nila, kuyang, sayang, ang ganda ng presyo, ngayon pa lang tayo nakakabawi. But if the prices are forced down, patay kang bata ka, baka magtiklo pa na lahat po yung mga babuyan na yan, mag-i-import na lang na naman tayo niyan ng baboy. Okay, but iba usapang baboy po yan. Let's go to the other area. Let's talk about state colleges and universities or state universities and colleges as it is referred to. Let's speak with the chairman of the Commission on Higher Education, Chairman Prospero de Vera III. Sir, good morning. Chairman, good morning. Baka nakamute kayo. Okay.
Good morning, Cito, and good morning to all your viewers.
Okay, nice to see you healthy at mukhang bagong tasa tayo. Okay, Chairman, you have been quoted as giving statements, reaction dito sa hindi pagkakaintindihan ng UP at Department of National Defense. Ngayon, lumaki na. Yung ibang universidad nagsalita na rin at napikon na rin kasi sinabi recruitment haven sila ng mga komunista. But as far as the CHED is concerned, and not to, hindi ako nang babastos, no? Talagang ignorante ako. Ano ba ang papel or role or authority ng CHED in this particular context?
Well, from the perspective of Chair, this issue is not just a UP issue. This is an issue for all universities, both public and private, and particularly to the more than 100 state universities and colleges. That's where we are coming from. And I think we have to go to the bottom of this. Ano ba ang pinag-aawayan? Both sides are saying the same things. They both say academic freedom is non-negotiable. It is constitutionally protected. The rights of the students and the welfare have to be protected, and that the laws of the land should be implemented. Both sides are saying that. So we have to find out what really are they fighting about.
Mhm.
And my take on this is that you go to the fundamentals. What is academic freedom?
Okay. May,
Thinking
may,
of
may,
the
okay, may I ask you, as the chairman of CHED, to give us what is the institutionalized or institutional definition of academic freedom? Kasi yan ang basehan eh. Kung ano ang sinabi ng pamahalaan or ng constitution, yun ang definition natin.
I'm trying to put together a group of eminent persons, Cito, to define this because academic freedom and its exercise has evolved over time. It cannot be a static concept. The globalization is upon us. Extremism in campuses all over the world is happening. There are advances in technology. And therefore, we must review and look at this again in the proper context on what academic freedom is really all about as a constitutional right and how can it be exercised. So I would defer to the eminent persons to define this. I may be part of the conversation, but I think this is a period of soul searching also for universities to redefine themselves in the modern period. So yun yung gusto kong mangyari, to bring together persons of integrity and probity, and the discussions, if there is common ground, becomes the basis for all sides to start putting this in writing. Because the problem with the accord is that it is very rich in intention, but very limited in operational guidelines. So it is what the result is that it is prone to differing interpretations and therefore differing complaints later on. The worst
Okay.
is Sito, the guidelines talks about a monitoring group. I spent 5 years as UP Vice President and now almost 4 years as Chair of the Board. I've never heard of this monitoring group ever meeting and reporting to the Board of Regents in the past 9 years. So the
Kanya nga,
problem,
kanya nga ako natatawa eh. Kasi tiga-UP rin ako. Yung tatay ko naging Dean of Student Affairs, Vice
narinig mo ba
Chancellor.
ito?
Wala akong
Narinig mo ba
nadinig.
ito? Wala akong narinig na ganito. Or kung nagmi-meeting man sila, hindi nagre-report sa Board of Regents. So kung walang monitoring,
Oops. Okay, slight delay there in the internet signal of Chairman De Vera, but that's an interesting point because there are two things that Chairman Popoy De Vera mentioned. One is that the extremism in state colleges and universities, because parang talagang counterpoint when you have extremism. And when we refer to extremism, it is primarily in general terms considered yung anti-government stance, radical, etc. Pagkatapos state university or college ka. So parang conflict of interest already. So that has to be addressed. And in general, of course, sorry, but most parents send their children to go to school to get a degree so that they can either have the facility, the training to get jobs or start careers or have their own business or have a life, and not make their school time or their college or university experience all about radicalism or marching. I mean, I'm just saying it the way it is, okay? Now, the other point is that agreement in itself, that accord between the DND and the UP, that marami po kasing ganyan eh. There are a lot of agreements, there are a lot of policies, programs, etc. But in the Philippines, siguro, I think it would be safe for me to say that 60% of the time, there's so many laws, so many agreements, that's just a piece of paper. Eh, sabi nga nila, pati nga ano. Okay, we have to go for a break, and when we come back, hopefully we get Popoy de Vera back on the program. You're back here on Agenda, and joining us again is Chairman of the CHED, Commission on Higher Education, Chairman Prospero de Vera. Sir, okay, so you're putting together a group of eminent scholars to come up with a definition of academic freedom. Now, during the past segment, you mentioned two important things for me: extremism, and ano na ba yung pangalawa, yung the fact that the DND-UP accord was so vague. There were provisions that were never observed or have not been observed, so needs to be corrected, or sabi nga ng DND, wala na, tapos na eh.
Yes, the Secretary Lorenzana has already said that he is open to a dialogue. The same with President Concepcion. So there is already an initial, mechanism for them to agree that there is a need to talk. We should start from that. No? So it is important that this issue be seen not as a UP issue, but as a higher education issue. Because if you're talking about the welfare of students, the UP students constitute only a small speck of the total student population. The student population of UP is about 50,000. There are 3.1 million students in higher education, more than 1 million in public universities. I think it is important on the part of the Commission that we look at it in that whole context. Not just UP, not just PUP, but the exercise of academic freedom in all universities, both public and private. That's why in the eminent persons, there should be somebody there to represent the private schools. Because they are as important as public universities in when we talk about academic freedom.
Okay, now let's talk about military presence, etc. I don't know if I don't want to stir the pot, so to speak, no. Pero you mentioned private schools or private universities. Why are there military trucks now inside UP? Pero hindi nila magagawa yan sa Ateneo at sa Lasal kasi private. But it doesn't necessarily mean that if it's private, wala ring mga groups that might be recruiting dyan. Should military presence be allowed in state universities and campuses or any university for that matter?
Well, it depends on how you define military presence, military presence in terms of discussing the concerns of extremism and letting
No.
security forces
No, Chairman. Military presence nakaparada doon. Nakaparada sila doon, gumagala sila doon. Kasi I support the military's right to go in to check or to discuss with I support that. Pero siyempre, you having been in UP, you understand the history of UP and the Diliman Commune. So, iba yun eh. Yung kanya naiiba ang UP, dumanak ang dugo sa UP. Okay? So, hindi katulad ng ibang universidad, dyan sa UP, nagkamatayan dyan. Okay? So, my question is, while we should allow the proper authorities access to the state universities, should they be allowed to park and make their presence felt and seen?
No, but Cito, the Defense Secretary has already said that that is not the intention and that will not happen. Secretary Rosario has already been quoted as saying there is no intention to station military and police personnel inside the campus. So,
Okay.
what is the issue? I think the issue should be under what conditions, will the enforcement of national laws happen inside the university.
Okay.
For example, it can go as basic as enforcement of basic law and order as far as criminality is concerned, drugs is concerned, all the way to the issue of extremism. Because
Okay.
all over the world, Cito, the hotbed of extremism are in universities. If you look at the case of Europe and UK and the others.
Well, wag ka na lumayo. Hong Kong lang eh.
Hong Kong lang. Hong Kong lang. So, kailangan i-define. Kasi we also don't want a situation where the rules are unclear and instead of being able to address extremism, we create a situation where the extremists will be able to park themselves. We don't want the extremists to park themselves inside universities.
Yeah, last week I wrote a column where I said, welcome the military. Don't treat them like the enemy and let them understand the culture of the university. Now, I interviewed Professor Clarita Carlos, and siya mismo sabi niya, alam mo Sito, dapat yung ating ano ba yun, yung equivalent ng War College, Philippine
National Defense College.
National Defense College, Dapat doon, dalhin na lang sa UP yan, yung pera ilagay doon. Kasi lahat naman ng profesor, karamihan ng profesor doon sa National Defense College na nag-training ng military and police ay mga tiga-UP.
That is true. That is true. But Sito, if you look at the situation in many state universities and colleges, the security forces engage in discussion with university officials and students. They don't have an accord, but they are able to engage in very legitimate discussion. So ang tanong, kung kaya sa ibang university, how do we make it constant across all universities? There must be a free exchange of ideas on security matters inside universities.
I think I can answer that. Dapat ang ilagay natin yung mga nasa mesa, yung mga 40 below. Tayong mga matatanda, pag naupo, lagi na lang bangayan lagi na lang duruan Sabi ko nga, ay nako, nag-usap na naman tayo mga matatanda, kanya walang mangyari sa bansa na ito. As Miriam Defensor Santiago once suggested, everyone above 60 or 65 should be shot, including Beltran. In any case,
I chair the board of state universities and colleges. In other state universities, may mga awards pa nga silang binibigay sa security sector for assisting the university. In their regular, awards given by the university, the PNP, the AFP are given awards for helping them. And yet in some universities, ang thinking they should not even set one foot inside a university. We have to create an environment where there is a free exchange of ideas inside the university.
Well, you made a very good point when you said that there was never really any effort. Parang accord lang, diyan ka dito kami. There was never any program. Now, you being the chairman of CHED, but hindi ko alam kung gaano kahaba ang tenure mo dyan, chairman, but no, but it's the reality, di ba? Is there still time, or how long will it take for us to be able to have a blended relationship with the student, the faculty, the military? Kasi iba na rin namang generation to di ba? Ilang years na, kumbaga sa Israelites, patay na lahat ng hindi sumunod kay Lord. Ngayon, baka may pagkakataon na. How long do you think, and can you do it?
Well, first, there must be openness to dialogue. That is non-negotiable. If everybody takes a hardline stance and would refuse to take one step back and look at the situation, then it will not happen. There must be openness. Second, we must learn from other universities without accords where engagement with the security sector is working. We must listen to them. We must find out what are they doing that is not happening in other universities. Those two elements are critical. That's why I said this is not just a UP issue.
Meron
it's a higher education issue.
Okay, meron ba tayong successful business model in the Philippines? Or mangungopya tayo?
Marami. Sa mga state universities and colleges, marami. In my state universities and colleges, the engagement is very, very fruitful. For example, in the PhilSCA, this is the Aviation State University, the commanding general of the Philippine Air Force sits on the board. Are you saying that the contribution of the Air Force is not important? They're a very, very good school, top aviation school in the Philippines. And they benefit from the contribution of the armed forces to policy making and to programs.
Yeah, pero on a bigger size, is there Mindanao State University or meron ba yun doon sa may Dumaguete, meron ako napuntahan doon ng magandang university. Is there such a thing, a successful business model?
Marami. I am confident that once we start listening, we will find out that there's a lot going on that we can learn from. I think the number one obstacle really is because of this situation. Different groups with different political agenda are using it to push for their own interest. We must depoliticize it and talk about it. No, na-preempt yung finding common ground by some groups who have a political agenda to push.
But
That is,
it raises also an interesting point, Chairman De Vera. I think it is also because the wounds were never healed, the apologies were never given, the answers were never put on the table. And I'm talking about martial law. I'm talking about the Diliman Commune. I'm talking about the so many people who disappeared. Hindi ko naman inaatang yun sa current administration. Yun yung nakaraan eh. Ang hirap sa atin kasi malalim yung nakaraan, so yung iba hindi magawang magpatawad. Okay. In any case,
or Cito, as you said, maybe we should take out the senior people from the conversation. Maybe that is where the wounds are deep. Maybe this new generation, if we let them be part of the conversation, maybe they have a different take or perspective on it. Baka yung hindi makapagpatawad is really the more senior generation because they look at it from a different lens. Maybe the younger generation has a different lens on it, and maybe it is easier to find common ground.
Well, I will leave that up to you. You are the chairman. I am just the interviewer. But nonetheless, I wish you all the best. And I do hope that the CHED in this situation can really step up and take the first step and get the guys to come to the table. Kasi the best is to make it apolitical. Remove the politics, remove the politicians, and just bring the two parties on the table. Preferably everybody below 40 years old. Okay, sir. Thank you.
Sito, I'm very happy because some of the people that I've talked to in the past few days, so I hope will join the conversation. I'm very open to joining. We should have confirmation of this in the next few days. I am happy they're very open. So
Okay.
I'm not at liberty yet to say who they are, but they are persons of integrity and probity, and they are very happy to join the discussion.
And if you can give me a perfect example where it works, then I would be so happy to feature them on the program. Thank you very much, Chairman.
Thank you, Sito.
Okay, that's Chairman Prospero de Vera III of the Commission on Higher Education. Let's move on to Undersecretary Maria Rosario Vergeire of the Department of Health. Good morning, Undersecretary.
Good morning, sir.
Okay, good to see you again. I was actually thinking about you over the weekend when Boris Johnson gave that press statement. The COVID-19 UK variant is truly highly transmissible, and then nalaglag yung pangako when he said we also have reason to believe it is even deadlier than COVID-19 because of the numbers we have seen. So what is our situation in the Philippines, Ma'am Undersecretary? Because I was monitoring. Originally, there was the carrier from abroad, his girlfriend, and his future mother-in-law. Baka ngayon, hindi na niya magiging mother-in-law dahil hawakan. Pero biglang may pumutok sa Calamba, sa Bontoc. Are these the same? Is there a connection? What's going on, ma'am?
Yes, sir. I just like to clarify, no, about the statement of Sir Boris Johnson. These are just preliminary findings. Gusto ko lang maintindihan ng ating publiko na according to our experts, because of the higher transmissibility of these variants, pag tumataas po talaga ang kaso, we expect more deaths, and that is really something that we are noting, no. And ito pong mga sinabi niya ay hindi pa ho yan founded, no evidence yet that it can cause severe or it can cause more deaths. It is just because when the numbers are increasing, therefore deaths may be increasing also. Now, as to the status here in their country, yun pong nauna po nating UK variant, no? Ito pong taga Quezon City. Wala po iyan kinalaman dito sa mga kaso natin ngayon na naitatala na 16, ano? Although of course, we are still studying this, but according to our reports right now, doon po sa nakita nating 12 sa Bontoc Province, isa sa La Trinidad Benguet, isa sa Calamba, isa sa Binangonan, isa sa Haro, Iloilo. ito pong galing sa Lebanon na dalawa, si Haro Iloilo and Binangonan, ay amin na pong kino-contact trace. Yung sa La Trinidad, Benguet po, siya po ay talagang taga Pangasinan. Doon lang po siya nagtatrabaho, although naka-dormitoryo po siya doon. At siya po ay nagkasakit, and now meron ho tayong tinitrace, about 84 contacts na po ang na-trace natin sa kanya, at nakakita ho tayo ng close contacts niya na meron siyang 4 na positibo na close contacts. Dito po naman sa mga taga BONTOC province, yung 12 po na apektado, out of this, yung close contacts niya po ay nakapaghawa pa ng 8 close contacts na nag-positive po sa UK variant. So makikita po natin talaga yung linkage, and we were already able to identify 3 clusters of infection dyan po sa BONTOC na pare-pareho po ang lineage. And all of this, 11 out of the 12 who are positive for variant of this UK ay may trace po natin dito po sa umuwing kababayan natin galing UK.
11 out of the 12.
Yes.
Okay, now, first of all, congratulations to the government, to the DOH, because it is clear that there is really a working contact tracing program na hanap nyo, so congratulations. Now, lahat po ba, are all of the COVID UK variant patients, are they all connected, one source, etc.? O meron bang pumutok? Kasi I read something that one case, I think was it the Binangonan case na, or I can't remember, ma'am, had never traveled, has no history of travel, and I was like, what is this telling us?
Yes, sir. Meron ho tayo ngayong sinasabi nga, no, itong Binangonan case natin, na ito hong Binangonan at saka Iloilo case po natin, galing po sila sa Lebanon, no? These 2 cases. They had histories of travel.
Okay.
Ito pong kaso natin sa Calamba, Laguna, ang atin pa hong inaalam kung ano po ang specific na mga detalye niya. Amin pong makukuha yung report na yan within the day coming from a regional office. Yun pong mga kaso natin sa BONTOC or sa Mountain Province, ito po ay nakakakita na po tayo ng pagkaka-link, no? Between and among all of these people, because there was this celebration, meron hong mga ginawang ritual sa Sagada,
Yeah.
na karoon po ng ganitong paghahawa-hawa sa mga tao.
Okay, there is a question that's lingering. I heard about this over the weekend. Na people want to find out, Cito, does this mean na pag ikaw lumipad sa eroplano, kahit na test na, etc., you could actually get infected inside the plane? Parang, is this proof that did they actually all get it? Yung mga nagdala, did they get it on the plane? Or because someone was saying, baka nahawahan yung isa dyan dahil sa dormitory o dun sa quarantine station, etc. I think the point was the person tested negative but was made to quarantine and then bigla nag-positive. So, yung issue is baka nahahawa yung mga ibang tao sa quarantine area.
Yes, sir. Unang-una, pag sa aeroplano po, according to our experts, the chances of getting infection is very minimal. Dahil maganda po yung airflow sa aeroplano. Meron ho talaga silang way of para bang reducing, no, this risk of getting infected in the airplane because of this airflow mechanism. Now, dun sa quarantine facility, kung matatandaan nyo po, yung atin pong index case ngayon, dumating po siya dito sa bansa ng December 11.
Yeah.
And na-test po siya, nung nag-negative siya, kinabukasan lang ay siya ay umalis na dun sa quarantine facility. Ito pong mga quarantine facilities natin ay per room. Ibig sabihin po, hindi po sila magkakasama. Tigi-tigisa po silang kwarto para maiwasan natin ang infection. So the probability of you getting infected in the quarantine facility is very minimal also. So ito hong sinasabi po na baka nakuha and all, tandaan po natin, ang testing, may appropriate time po para mag-test tayo. So minsan, most of the time actually, kapag kayo ay magkakasakit, ang inyo pong viral load tumataas lang 2 days prior, no, na magkakaroon na kayo ng symptoms, o kaya kung asymptomatic kayo, 2 days prior the infection will begin. So minsan ang mga tao kapag tinest sila, wala pa ho yung spike ng viral load na increase, hindi po yan
Mm.
makukuha nung test. Kaya nga po tayo ngayon ay nagpapatupad na kapag dumating kayo dito sa bansa, ite-test kayo, ika-quarantine kayo, tapos ite-test kayo uli sa pang-5 araw. Dahil according to our experts and evidence, 5 to 7 days po talagang tumataas na yung viral load at makukuha na po natin yan sa testing.
Okay, now the issue of prolonged quarantine even with the second test protocol. Kasi may mga nagsasabi they fully support the DOH decision for a second testing. But these same people, lalo na yung mga foreigners, sinasabi, why do you have to make people stay longer if there was already a second test and that second test presumably will show whether or not a person is infected or negative?
Actually, sir, the current protocol, the most recent one, ito nga pong kapag ka nag-test kayo pagdating nyo, tapos ite-test kayo uli ng second test on the 5th day, and the instructions and the protocol would state na pag nag-negative kayo dun sa second test nyo on the 5th day, you can now be endorsed to the local government. And you will continue your quarantine period in your hometown.
Okay.
Depende
Okay.
na ho yan dun sa local government.
Uh-huh.
Yes, sir.
No, go ahead, ma'am. Kasi I was just following up on yung sinasabi nyo. Okay, so if you test negative on the second test, which is given on the 5th day, you will be endorsed to your local government, barangay, or mayor, and then depende na kung sasabihin nila, o sige, pagpatuloy mo na yung quarantine sa bahay mo or patuloy sa hotel. Or hindi pwede sa bahay because last I heard parang ayaw na ni secretary ng mga home quarantine at doon daw nagkakahawahan yung mga pamilya.
Actually, sir, hindi talaga namin ini-encourage ang home quarantine. But there would be times na itong pong mga kababayan natin ay meron naman ho silang adequate na quarantine room in their house. Katulad ng meron silang sariling palikuran, may sarili silang kwarto.
Okay, I think we had again another signal, well not signal, but another internet problem there. But we will try to reconnect because maganda pong information yon that the contact tracing program of the government is actually being actually effective. They are able to trace kasi ang hirap ka naman po niyan this COVID-19 B117 variant. Nako po, sasakit ang ulo natin dyan and I think many of us have been active, been moving around lately. Please lang, please, wear your mask. And ako po, sinabihan ko na lahat ng mga tao sa paligid ko. I know it's not easy. We all have lapses. But as much as you can, even inside the house, if we're working together or just wear your mask. Okay, we'll go for a quick break and we will try to get back with Yusek Vergeire and the rest of the program here on Agenda. Okay, you're back here on Agenda. I'm Cito Beltran, your host, and you are watching us via Signal TV, channels 8 and 250, as well as on Facebook, facebook.com/OneNewsPH, and on YouTube, just type in One News PH. Okay, we will try to reconnect with Yusek Vergeire, but if not, we will go on with the program. Ano lang po, no? Notice lang po doon sa mga nagte-text sa akin during the program. It's quite difficult for me because I haven't set up the dedicated phone for your messages, lalo na yung mga nagme-message of Facebook, because I have to coordinate with with our executive producer Gab Malyari. And while I'm doing that, kung pupunta ako dun sa Facebook messages nyo, patay na ang Kuyang Cito na napaka hindi techy, no? So pagpasensyahan mo. Okay, let's go to Undersecretary Vergeire. Let's finish up on that conversation. Yusek, tanong ko lang, no? Is it possible na magkaroon ng sariling variant ang Pilipinas or mag-mutate yung COVID-19 here na mapagkamalan, akala natin B117, pero yung pala, it's the same mutation just occurring in the Philippines naturally? Because I've spoken to virologists and they said that mutations happen all the time. Oopsie daisy. Okay. I don't know if okay, we will try again to reconnect. Okay, if not, okay, let's go on with our third interview, actually related naman because he's also the adult infectious disease and tropical medicine department head sa San Lazaro Hospital. We've interviewed him and he is great to talk with, Dr. Rontgene Solante. Doc Rontgene, good morning. Welcome to the program.
Hi, Cito. Good morning. Good morning.
Okay. Alam mo, dami ko nababalita ang kwento sa iyo. Meron ka naging pasyenteng kakilala ko na, naku, nasa hingit na rin ng kamatayan, talagang nasa. In any case, Doc Rontgene, I think, the biggest concern right now is the UK variant B117 and the latest press statement of Prime Minister Boris Johnson out of the United Kingdom, where he confirmed that 117 is highly transmissible, but they also have reason to believe that it is even deadlier or worse than COVID-19 in terms of impact. Now, here's the thing. The question is, how does this apply to the Philippines, especially to your hospital? Yun bang UK variant, iba ang treatment protocol? Mas mahirap bang gamutin or hindi gamutin? There's no medicine for COVID-19 But how mas mahirap bang i-manage?
Yeah, thank you for that question, because I think that's also the concern and the most common questions among us, among doctors and specialists. But so far, in terms of the study, the specific characteristic of this B117, it doesn't seem to be a more virulent organism. Mm-hmm. More so that the current treatment may still be applicable, but there are specific treatment that the scientists now are looking at if they will still be effective or fully effective. I'm talking about the monoclonal antibodies. Okay. We don't have that here in the Philippines, but in other countries they are now using that monoclonal antibodies. It's the same mechanism. It's an antibody specific for that virus that will block the what you call this, the binding of that virus into the cell of human receptors. And because that area of the binding is the spike protein, which is the area of the mutation now. Mm-hmm. So there is a possibility that it may not be fully effective. It may be less effective, but still the concern now is they're going to monitor most of these patients who are with this variant and the effect of this monoclonal antibody treatment.
Okay, the monoclonal, clonal ba clocal?
monoclonal antibody.
Yeah, monoclonal antibody. Is that a live component or is it a chemical product?
It's a extracted antibody, synthetic antibody, and
Mm.
specific for the coronavirus. And I think that's one of the cocktail that has been used for the treatment of President Trump before. No, it's still under investigation, under clinical trial. But I think they have had good success among patients in those countries who are now using it. In fact, that's part of their standard regimen already.
Okay, di ba dito meron naman tayo yung study on on yung sa VCO, virgin coconut oil. Napangiti ka. Okay, hindi ka. Wag mo na sagutin eh. Nangiti ka na dyan eh. Parang skeptic. No, because I just heard that people were saying it had good promise and people who take it would be less susceptible or recover better, etc. Locally, is there anything on the table that seems to help? Because someone even asked me, "Are you taking blood thinners?" I said, "Yeah." Oh, because there's this study, blah, blah, blah. Sabi ko, nako po, hindi ko pa, wag na. At ang dami yung mga science dyan. But is there anything locally that has promise?
It's so far as we have been treating our patients with COVID, especially those who requires oxygen. I think that there's really good what we call this advantage and benefit. With some benefit with the use of steroids, with the use of remdesivir. And I think what is really crucial here, Cito, this is now based on actual experience in dealing with these patients with COVID. There is always a time lapse between a patient from a mild, moderate, and severe. And we have always observed that for those individuals who go to the hospital early, before the development of the severe form, there is a higher likelihood that they can survive or they will survive compared to those who goes to the hospital and already in the what we call this in the severe form. No, that's why that's always our message that as long as once you have the symptom, number one, and you are elderly, you have a lot of these comorbidities, then you really have to go to the hospital because that's the early intervention alone can really matter a lot between survival.
Doc, when you say go to the hospital early, ubo-ubo, punta na ng hospital, lagnat, punta na ng hospital, LBM, punta na ng hospital.
Yes, precisely. So
Okay.
if you have someone 50 years old, diabetic, hypertension, then you have to go and have yourself monitored.
Okay, kasi yung iba sasabihin, kuya magpapacheck na lang ako, magpapa-blood test na lang ako or magpapa-COVID test. Is that a good idea or should they first consult with the physician?
They should consult because the moment that they have those symptoms, part of the case definition of COVID, then they have to be tested. It's not just because they want to be in the hospital, but we also want to also involve the contact tracing because that's the problem now of why we were not able or we continue to have what we call local transmission.
Okay, now what is the situation on the ground or in San Lazaro Hospital? Because yung sa UK, ang sabi ni Boris Johnson, ang problema nila doon, pag nagputukan na and then the beds are all occupied, that is their biggest nightmare. The health services. Now in the Philippines or in health, kasi San Lazaro, kayo talaga yung battleground in many instances. How is it? How are we managing?
So far, most of our patients that are admitted are mostly in the moderate to severe. No, so meaning it really has strained our intensive care unit. Palaging puno yan. And if we don't have the intensive care unit to cater for more severe, gumagawa kami ng paraan na doon sa ward na individual room, we have to convert it to an ICU-like setup just to make sure na ma-monitor namin. No? Pero iba pa rin yung intensive care unit na setup kasi nandun yung central monitor, nakatutok ang doktor at saka nurse doon at saka mas closely monitor natin yung konting mga changes lang doon sa mga nangyayari sa pasyente. And I think most hospitals has the same problem because aside from COVID, there are also non-COVID critical care na kailangang i-admit din. So medyo doon nagkakaproblema, especially if this patient entails the need of mechanical ventilation. So we need to prepare for that, no? Because with this variant, as we have mentioned, the increase in transmissibility automatically increases the rate of cases yan. And sino ba ang na-admit pag tumataas ang kaso? Makikita natin yan, the elderly, no? Those with comorbidities. And these are the patients that usually necessitates intensive care unit. Doon kasi ang burden talaga ng alaga doon sa mga critical care cases.
Okay, I hope no one accuses me of being a elitist or judgmental, etc. No, sincerong tanong to. Kasi alam mo, kada umaga pag dumadaan yung mga basurero dito, mga barkada ko yan kakwentuhan ko. And lagi ako nagtatanong, kamusta na kayo? Wala kayong mask, wala kayong mga gloves. Hindi ba kayo tinatamaan ng COVID? At sabi nila, sir, wala, 200 kami, ni isa sa amin, walang may tama. What is the reality there in the hospital? If you profile yung mga patients, sino ba ang mas madalas lumanding dyan sa ICU mo o sa ER mo? Yung mga maayos ang buhay, maganda ang bahay, masarap ang kain, o tabla lang, walang pinipili, it's the same?
There was a time na talagang parang the middle income, no, at saka yung talagang lower income were admitted. Alam natin there was that time na talagang ang taas ng local transmission, no. But lately, we have noticed na ang kadalasan dito are usually those who are staying.
Naku, Doc, nawawala ang audio mo.
Ay, sorry.
Ayun yan, game. Okay. There was a time...
There was a time na talagang nandun din yung mga ganong low income at saka yung mga middle income, no? At saka yung higher income. Now, since this is a government hospital, really we can get mga high income patients, no? So it's really the low and the middle income. And lately, ang nakikita namin are really those who are really working kadalasan at saka yung mga relatives nila na na-expose doon. Parang mataas ang household transmission. Kapatid ni ganito, mother ni ganito, pinsan na ganito, na merong ganito. So more or less there is really an element of yung gathering among themselves kaya na-admit sila.
Ayun. So wala nang economic profile, walang rich, middle class, kumbaga ang labanan ngayon diyan, pamilya, nagiging package deal.
Yes, correct.
Aray ko. Okay, last question, Doc Rontgene. Meron ka raw sinabi or you made a statement that the national government should reconsider or should evaluate their policies for travel in the country. What should the government be paying attention to?
I think the government has already done a lot in terms of the travel restriction, no? Tumataas na yung mga bansa na pag we restrict travel to the Philippines, and at the same time they have modified their quarantine procedures for those coming from areas without the COVID variant, that they'll have to go quarantine and testing. So I think it's just a matter of really monitoring this variant. Ang labanan ngayon is don't we have the local transmission because of these cases na nakikita doon sa, as mentioned by Dr. Vergeire kanina, na medyo talagang marami-rami na rin yun. No? And as you have mentioned, and I totally agree with you, what is really crucial here is the contact tracing and the case detection before it will get out of our hand, no? Kagaya ng previous cases.
Okay, ang hindi nasagot ni Yusek Vergeire kanina, is there a possibility na merong local mutation na natatag lang natin na B117? Kasi some people I spoke with have said in the past, Cito, it mutated in South Africa, it mutated in UK, it mutated in wherever. Is that possible?
Yeah, so tandaan natin, no? Ano ba yung rationale for the mutation? Okay? One of the important driver of mutation is if yung tinatawag natin na as the virus stays in the community or in the host, especially for those persons with a poor immune response, and they cannot totally eradicate the virus inside their body, like mga immunocompromised. That was documented, no? The South African variant was documented among immunocompromised patients with cancer and patients with HIV. Longer shedding, the virus mutated, okay? And that's why it escaped the immune response. There was some report before in Netherlands that the mutated virus came from mink, yung animal, yung mink. It came and it jumped to human, no? Parang ganon. So there are a lot of factors, and these factors may not be unique to these countries. That's why I was telling before that there's a possibility that if this pandemic will be longer than what we are expecting now, especially the vaccine is not yet available, then there's a possibility that we might have, sana hindi mangyayari, our own variant of this COVID virus.
Okay. Well, I have to leave it at that, Doc Rontgene. But thank you for your time again, and I hope to have a longer conversation with you in the future. Pero sana mostly about good news at hindi puro ito perwisyong inaabot nating lahat. Thank you very much for your time, Doctor.
Thank you, Cito. Bye-bye.
Okay, that's Dr. Rontgene Solante. Siya po ang head of the Department for Adult Infectious Diseases and Tropical Medicine sa San Lazaro. So there you go. Alam niyo po, no, marami sa atin, we were hoping that 2021, wow, would all be good news. Would be, and then we're still hoping. I'm still praying, we're still believing, and we should continue praying, hoping, and believing that the vaccines will arrive. Okay? Wala na tayong labeling kung anong klaseng vaccine, kanya-kanya na. KKB tayo, kanya-kanyang bakuna kung gusto ninyo. But let's pray together that A, the vaccines will come, B, that the Filipinos will not suffer this B117 outbreak, etc., and that our numbers will go down. And para po mangyari ito, makisama kayo. Think of yourselves, okay? Di bali ng snub, basta nakamask. Di bali ng snub, basta naka-social distance. And then wash our hands. Ay, alam niyo po, we need to do that. And okay, so I'm just praying that all of you would have a great day, a great week. See you tomorrow. God bless all of you.